I'm Dr. Nixon with Healing Peak Regenerative Medicine's Longevity channel, and today I want to talk to you about chronically tight muscles. There are a lot of reasons that this can happen, but if there's no issue with the joint and the muscles just continually, repetitively tighten up over time, that can cause some scar tissue in the muscles themselves or calcifications in the fascia. And the fascia is the encasement of the muscle. So like on a chicken breast, when you peel the skin, or not the skin, but like there's kind of a layer, an encasement, that's fascia. And every single one of our muscles has that. And over time, if our muscles get chronically tight, we create little calcifications and scar tissue within that area, even if there was no direct trauma to that area. It happens because when the muscles are tight, it's hard to get water, electrolytes, nourishment to those muscles to help them relax the way that they should, right? And so there's some treatments for that. One primarily is trigger point injection therapy. I love this therapy because it's an intramuscular injection. There's no unwanted side effects. There's a couple of post-treatment soreness days after the injection, but you don't have to stop working out. There's really nothing that you have to stop doing. It doesn't interact with any medications or supplements, and it's really effective at relieving chronically tight muscles for very long periods of time, and over time, sometimes forever. And so people who have been suffering from chronically tight muscles because either they work at a desk job and they're chronically like sitting in the wrong position, or they have some trauma to the area, or it's a previous injury and everything's healed up, but those muscles got injured and so they just kept tightening up and never were reminded to relax. Those are really great situations to use trigger point injection therapy. And I've had amazing results with this type of therapy for people who are going to get many different types of treatment all the time to relieve these tight muscles. Massage, PT, chiropractic, acupuncture, which I also do, all the different therapies you can think of to relieve tight muscles, muscle relaxers. People are on muscle relaxers all the time to try to relieve this tightness. Trigger point injection, by and large, is the most amazing therapy for that sustained relaxation of the muscles, and you don't have to take anything for it, and you don't need to come in every week to keep it going. It will eventually sustain itself so that you don't have to come in anymore. I've helped people get off of many pain medications, both opiates and over-the-counter pain medication, just by using trigger point injection therapy. It's not a very expensive therapy. In fact, it's one of the least expensive therapies that I practice, but has incredible results. And so it's a really good entry point for many people who are suffering from chronic tension that just won't stop. And the way that it works is that the trigger point, what by definition that means is a knot in the muscle is radiating pain to another area. And if you were to look up trigger point in a muscle, if you were to look that up on Google or whatever and look at the images that pop up, you'll see a bunch of charts that show what different trigger point patterns look like, and that kind of gives you an idea. But basically it's a tight muscle spot where, like, if someone presses on that, it shoots pain somewhere else. But it can also just be really tight knots. Like if you have a knot that won't quit, like trigger point injection therapy is the way to go. It will get rid of it. And acupuncture does this too. That's where I was like, okay, where do I want to go with that? Acupuncture does this too. So I will release trigger points in patients with acupuncture needles also. It does not work as well. It works pretty well, but you have to come back more often to get the same result. Where a trigger point injection, if you get one, you don't need to continue to come back as much as you would with acupuncture. And the reason for that is partially what the solution is in the injection itself, and the response of the muscle is greater when you inject something into it. Trigger point also means the muscle involuntary twitches when you stick it with any needle. Acupuncture, dry needling, trigger point injections, any of that will elicit a involuntary response, which is like a reset button for that muscle. Once that twitch happens, that muscle is resetting to relax, to do what it normally should physiologically do, which is help you move and not keep you tight. So I just wanted to do a quick and dirty video on trigger point injection therapy because so often I have people come in and have no idea what it is, have no idea it's been available to them, and they have been either taking muscle relaxers, over-the-counter pain medications, constantly going to massage, sometimes twice a week, just to keep things, sort of good. And so if that sounds like you or anyone you know, please refer them to this video. I'm not the only one who does trigger point injection therapy. It's pretty widely used, at least on the West Coast. I don't know about the whole United States. But it's definitely something worth pursuing. And if you know anyone, I practice in the greater Seattle area. The phone number for our clinic is 206-899-6000. Please share this video. There are a lot of people out there suffering from pain that just don't need to. Thanks so much. Have a great day.